The following program has been rated GE by the Kenya Film Classification Board. It is therefore suitable for general family viewing.
Hello viewer, welcome to Chungu cha Jamii. My name is Betty Akuku. I am your host today and we are going to be discussing about cancer. I am joined by a doctor who is going to be taking us through the same because there are a lot of myths about cancer. But today we have someone to take us through the right information about cancer. Tune in and let us hear from him.
Thank you so much, Betty. I really appreciate being here. Although today with these unprecedented times, it's just weird because we're using Mtandao to be able to communicate. We're using a Zoom link, which is very strange. I wish it was like the old times when I could see you just in person and shake your hand, even give you a hug. But now it will have to be a virtual handshake. So myself, I'm Dr. Anjohi. I'm a gynecologist by profession, and my job here today is just to make a lot of noise that people to go for screening. That's the take-home message of this very important and engaging discussion. Let's go for screening because screening saves lives.
Okay. Welcome, Dr. It's always a pleasure to host you because you have the right knowledge and the right information that people need out there concerning cancer. So this month of October, there's a lot of awareness going out about cancer. One of the things that sounds strange, doctor, is that as much as we have created awareness, there are still basic things that we do not know and also we have not learned. It is until cancer strikes you that you begin to find the little and basic knowledge about it. When it is still far from you, you don't even care. But people are getting cancer. We are having diagnoses, I think, weekly, monthly, daily. I'm not sure. But tell us more. What is cancer? How can I not be a victim?
So, in a nutshell, a cancer is a growth in the body which has the ability to spread to any other part of the body. So it's very important for the audience and the one who is watching this to just be aware that cancer cells are forming in our bodies every day. And because of a good, strong immune system, we are able to control the cancer cells from duplicating, from becoming too many. So this is through a competent immune system. So the first cancer cell is going to be microscopic. You cannot even see it with your naked eye. The immune system, it should have identified it and destroyed it. Now the cell starts reproducing. So where there was one cell, it gives birth now two. And it does not produce the next one to be three. The two will reproduce. So the next one will be four. So it will grow exponentially. The cells are going to replicate many times, and then it becomes something you can see with your naked eye that here is a growth, or something you can feel in the part of the body, or something a scan can pick, or a CT scan or whatever can be able to pick. Still, the cancer is still contained in one spot. After that, it's going to invade the blood vessels. And then from there, it is going to spread through the blood system to any part of the body. So you can imagine it going to the brain, to the heart, to the lungs, to the liver, to the kidney. So now it becomes now metastatic cancer. So those are, now when somebody comes to hospital, when they're in that stage, we say it is the final stages or stage 4 of cancer. And for someone like that, we cannot do much for them. We now want people to come when it's either microscopic or even before it has begun, so that they get the guidance which they need.
Okay, so basically you're saying that all humans have cancer cells in their bodies. But today, at what age then can cancer attack you and actually become a disease? Because if we are living with these cells, then it means we can live healthy even without knowing, So what is the age that cancer could actually attack you and make you a victim?
So that's a very good question. Most people think that cancers only affect old people, or they only affect women, or they only affect men. But with all cancers, remember these cells are forming in our body day in, day out. Today they'll form and then they are destroyed. Then another part of the body will form an abnormal cell. Then my immune system captures them and destroys them. But then there are some people who have some risk factors. So you find somebody with a risk factor is going to somehow encourage the cancer cell to grow and to reproduce, as opposed to someone who does not have the risk factor. So you said rightly, one of them is age. So somebody who is very old is going to be more at risk of getting cancer than somebody maybe who is a teenager or in their youth. That being said, there are also some cancers which affect the very young. So some people, maybe a small child is going to have a growth and it actually turns out to be cancer, such as this one called Burkitt lymphoma, which is common also in Kenya. So age is a factor. Number two, one's lifestyle. So one's lifestyle is also a factor. The lifestyle is a modifiable risk factor. You can change your lifestyle today. If you hear something, I've mentioned something, and you think you might benefit from doing it or not doing it, then you can be able to prevent cancer in this way. Their age is non-modifiable because you cannot dictate your age.
Yeah.
This year you'll be older, and the other year you'll be older.
Yeah.
So let's go through the non-modifiable. So one is age.
Yes.
Number two is gender. You see, maybe prostate cancer will affect a man, such as myself, but a lady will not be affected by prostate cancer.
No.
Number three, family history. So our family, we have a family history of cancer. For example, cancer of the breast has a strong family history. So we should always, even as healthcare workers, ask our patients, have you ever suffered from cancer, or has any member of your family suffered from cancer? Number three, there are also genetic syndromes or genetic diseases which increase the risk of cancer. For example, there are some people who have genetic abnormalities in their body which will predispose them in their future to cancer. Now, let's go to the modifiable risk factors. So, some of them include someone's diet. Eating a diet which is very fatty, a diet which has a lot of junk food in it, an unhealthy diet, then it is risk. In the diet also, eating food which has been burnt. So sometimes when you cook food, you find that the onions are burnt, the meat has burnt, everything kind of is burning. The nyama choma has burnt, everything is burning. The ugali is burning. So once the food becomes now burnt, that one is a risk factor for cancer. Another thing is less vegetables and less fruits in one's diet. That's another risk factor. So increase your diet, vegetables and fruits. Smoking, alcohol, drugs. Those are modifiable risk factors. Stop them. Finally, maybe we can say infections. So there are infections which predispose somebody to cancer. For example, cancer of the cervix is spread as a viral disease and is spread mostly through sex. HIV also weakens the immune system. So again, that one is modifiable. If one can prevent themselves from catching the disease, then they are safer than someone who now is treating the disease. In a nutshell, those are modifiable and non-modifiable risk factors. Modifiable, we can change. So let's aim to change the modifiable risk factors.
Wow. That is such an elaborate illustration on the causes and even generally about cancer. I was going to ask you, who is more predisposed to cancer between men and women? Of course, men cannot suffer cervical and breast cancer. They would only suffer prostate and pancreas and those other things. But looking at the statistics today, who are more predisposed? Who are your most patients when it comes to men and women who are more infected?
So that's a good question. In terms of the gender, we find, depending on the cancer or on the region which is being which we are discussing, maybe if we are saying cancer of the prostate, it will only affect men.
Yes.
Maybe we think maybe cancer of the cervix can only affect women. Okay, and cancer of the breast can affect both men and women.
How?
In general, because men also have breast tissue. In fact, a man, the breast tissue is not supposed to be functional at all. But on this man, you find the breast tissue has formed a lump. So it's more likely for a man with a lump to have cancer than for a woman who has a breast lump. So men should be aware and should also start examining their breasts.
Sounds really strange.
Sorry, for men, just to answer your question, men will be more predisposed than women to cancer formation. Why? Because they do more of the modifiable risk factors. For example, more men are going to smoke than women. More men would consume excessive amounts of alcohol compared to women. Men are going to expose themselves to risky environments. For example, maybe they somewhere with maybe a nuclear factory. Radiation can cause cancer. So you find majority of people who work in such risky environments are men, not women. So men will be more.
So men are more predisposed.
Yes.
Wow, that's news. That's news. Doc, as you are working in the hospital and handling cancer patients, at what stage do people mainly realize their cancer position? Because sometimes you would rather have the symptoms and you see the manifestation, and if you are aware, you could run to hospital and have it checked. But do people come at level 1, stage 1, or they come at stage 4 when very little can be done?
So the reason why this month of October was created is to talk about cancer and for people to get screened, is because the government saw that we are losing the fight for cancer. What happens is that majority of the patients don't know they are unwell until when they are very sick. When the cancer has spread to various organs, and there's not much we can do to save that person's life. So then you hear that sometimes you hear maybe even on some shows, they say the doctor told me I only have 6 months to live. So that happens a lot in Kenya.
Yes.
Whereas in the West, because people are more proactive, they are going to the hospital even before any symptoms come, and they say, please check me for cancer of the breast. Please check me for cancer of the cervix. So they are being diagnosed early when it's very small. The treatment is very cheap, and the recovery is much faster. And so then you hear so many people in the West saying, I'm a cancer champion or I'm a cancer survivor. Most in Kenya will be cancer victims. So please
What's the difference? What's the difference between cancer victim and cancer survivor? Is the survivor the one who has overcome and is now well without any cancer cells, and the victim the one who is sick and nothing can be done about it?
Exactly. A victim is, we are saying, that one, their goose is cooked. Whereas the survivor or the champion is the one who has recovered, who has conquered cancer. So
now then, Doc, if you allow me, do you feel some symptoms that will push you to hospital? It's not like a pregnancy that, I have missed my periods and they were supposed to be coming, so I need to go and confirm. What would make me and trigger me to run to hospital with a cancer suspicion?
Now the challenge with that's a good question, because most people say I go to hospital when the symptoms begin.
Yeah.
The challenge with that is that you find the somebody is waiting for symptoms to come, and yet they'll only come when the cancer has grown significantly. For example, maybe somebody with let's say a common cancer is colorectal cancer, or maybe let's take that one for example. So the cancer starts growing in the intestine. Someone is just eating normal, has no issues. Maybe later, when the cancer is already now big, it's blocking the way for the stool to come out. So somebody feels that I feel like going to the toilet, but when I go, nothing is coming out. They still overlook. They say maybe I have some constipation. Then they might feel maybe see some bleeding in the stool. When they see some bleeding in the stool, then they are going to say, maybe this is just normal. Let me give it a month or two. By that, after that, they go to hospital. When they go to hospital, it's already too late. Let's not wait for symptoms. Even the non-specific symptoms, I'm feeling a slight headache, which it never goes away. Every day I'm having a headache, and I want to be more keen and go to hospital for screening. Screening saves lives. Prevention is better than cure.
I think you should say that again, because there's this notion that people have that what I don't know doesn't kill me. And this is not true, listening to you, because if you don't know, it's a stage 1 and you're feeling just lightheaded, you are seeing blood in your stool, you are struggling with passing stool, and you're just assuming that this could just be a small digestion problem, and so you assume it, and yet it's something growing. But when you think about cancer in your head, having heard about it, there's a thing that, I may just go and then they find it is cancer. So people say, as long as I don't know, it will not kill me. What do you think about that statement? With you here shouting about screening.
Yes, those are the people who, if God forbid it's actually cancer, they are going to present late, and then we are going to tell them, now you need chemotherapy, you need radiotherapy, you need palliative care, pay over there the reception 2 million shillings so that we start the treatment. Then somebody starts organizing harambes. Then the neighbors start saying, this person, what did they do wrong? So to avoid all that, let's all just be encouraged. Let's go for screening. Let's not overlook the symptoms. I vomited and my vomit has some blood. Let me not overlook those symptoms, because that might be what cured me from cancer when it was very small. And then after that, I continued to live another 20, 30 years of a very productive life.
Doc, yes. Is there hope? Is there hope when you find that you have cancer at stage 1? Now that you are pushing people to go for screening, just if somebody comes and they find that they are at stage 1, stage 2, is there hope? Is there a difference between that person and the other one who has waited until they are at stage 4?
Yes, we normally give some, in medicine, we are supposed to give somebody something called prognosis. Prognosis is to say, how likely are you to recover from this? So from the research which has been done, prognosis of stage 1 cancer is almost 90%, that somebody will recover and be just normal. For stage 4 cancer, depending on the cancer, it can range maybe between 5 and 20%. Meaning only 5 out of 100 are going to survive to live a healthy, productive life more than 5 years. Whereas if we are saying stage 1, more than 90% out of 100 are going to have full recovery after 5 years. So it's so important for somebody not to come to hospital at stage 4. If you come at stage 4, I'll give you a bad prognosis. But if you come at stage 1, I'll tell you, nika kitu kadogo, let me remove it today, and tomorrow you continue, you go back to work.
Okay, that brings us to the treatment. You know, when people hear about cancer, the obvious way they know that they're going to be told is to go through chemo. And when you hear about chemo and the way it kills all your cells and the way it destroys you and the way all your hairs fall off and the way you become miserable, people would rather not even dare come to your office. So must someone go through chemo at stage 1?
No.
Okay.
Actually, if the cancer is small, okay, it has not metastasized. What that is to say, it has not spread outside to the rest of the body. Then they don't need chemotherapy, they don't need radiotherapy. It is just to remove those cells, to excise the cells, and somebody can continue, can retain even the function of that organ. For example, today we are saying cancer of the cervix. If cancer of the cervix is detected early, we can go remove part of the cervix, and somebody remains with their uterus and with the rest of the cervix. Meaning, if they want to get pregnant after that, they can still go ahead and get pregnant. Whereas somebody came late, maybe actually for cancer of the cervix, stage 2. Stage 2B is late. So when somebody comes at stage 2, then we say we'll have to remove the whole uterus, including the cervix. So that person maybe was wanting to get a baby in the future. Now we remove the whole uterus and the cervix, meaning they can never get pregnant again. So this is one of the benefits of screening, that the organ is left with the patient, or the patient is left with their organ.
Wow, very hard and sad truth right there. Let's talk about breasts and cervical cancer. You know, how do you diagnose? Because sometimes people have also this thought that it's extremely painful, they're gonna do this and that. You know, there are those things that pull people back and they don't wanna come to just check because of the fear of the unknown. What do you do when we come?
So basically, actually this month we are talking about those 3 cancers: breast, cervix, and also prostate. Why breast and cervix? Is because the breasts are just here. The cervix is just here. It's not like somebody who has a brain tumor who has to do so many tests before they know that they have a brain tumor. The breasts are just here. Even just by touching like this, you can say this breast has something. I remember even men have breast tissue. So even men, I hope you're watching. For ladies, the cervix is just here. It's the one that opens so that the baby comes out. Now, the cervix is just here. So that's why we're making more noise about that than maybe cancer in the lung or cancer of the pancreas. But also those cancers are there. Now, how does somebody check? So clinically, even in this show, we can be able to go through how somebody can examine their breast. People, the viewers at home or in the office, wherever they are, even in the studio, they can be able to examine their breast even there as they are organizing this show and then other shows. For cancer of the cervix, somebody needs to go to hospital where we do something called a cervical cancer check. There are 3 methods we can use. One is something called pap smear. I think that's the one which is known in the country so much.
Yes.
The second one is one which is called VRVD, where somebody is given their results instantly. The third one we can do is something called HPV DNA. That one is more sensitive and also more expensive. So we look for the cancer-causing virus from cervical tissue. So that one only takes maybe 1 minute to remove the sample. Now I ask all ladies, would you prefer the pain of
Pap smear.
1 minute, or would you prefer a whole year of pain, of needles, of chemotherapies, of radiotherapies, of theater? Which one would you prefer? And so I think the lady should be able to think in her head, yes. Normally, a long time ago, we used to have jokes or stories as we are young, where you're told you're at the bank of a river, and behind you there's a lion which is chasing you. There's a tree next to you, there's a snake which is on the tree which wants to bite you, and in the river there's a crocodile which wants to eat you. So now a kind of a similar situation. So the lady should choose. Is it the lion, which is the pap smear, which is chasing her from behind? Or is it the crocodile, which is in the water, which is the cancer, which wants to eat her up? Let her decide.
Wow.
Sorry, I've forgotten to mention, for cancer of the breast, when a lady comes to the healthcare worker, we'll examine clinically. If someone is above 40, then we do a mammogram in addition. Yes.
Okay, and that will give us the result in how long?
Within 1 day to 1 week, depending on the institution, then we'll be able to know, is there a problem or is there no problem.
Okay, I would like us to know, maybe from you, which is the most popular cancer? And as you answer that also, how many women, would you know how many women are today in Kenya cancer patients?
So the most common cancer is cancer of the breast. So and this one affects both ladies and men, but especially ladies who are older and have a positive family history. They'll be at a great risk. Now, the cancer that causes the most death is cancer of the cervix. Meaning, more people who have cancer of the breast, because of people screening their breast, they will survive longer. So more ladies will be diagnosed with a small cancer in the breast. For cancer of the cervix, less ladies are going for screening of cancer of the cervix. So the cancer of the cervix will remain longer. So when somebody comes to hospital, when we are diagnosing them, they are maybe stage 3 or stage 4, of which the prognosis is poor. So most of them will die from the cancer.
So it's so important.
Yes.
So most of the cancer deaths are cervical cancers.
Most of the cancer deaths of patients who have been diagnosed. Remember, there are also many people who are walking around who have never been screened. So those ones we don't know. So maybe it should be number 1 between the two, cancer of the breast and the cervix. It should be number 1 in Kenya. But because so many women are not going for screening, actually they say it's about 5% of women, 3 to 5% of women in Kenya are the ones who are going for screening. Majority are not going. So they are walking around with small cancers, all of them, and we are not diagnosing them or even helping them to lead a productive life. They are going to stay maybe another 15 years. Then when they come to hospital, they have stage 4 cancer and then they die. So they look fewer, but all of them who come, they are dying. They are not coming and recovering. They are not cancer survivors or cancer warriors. They are cancer victims.
Okay. Doc, what is making them shy off from coming to test, though they may have symptoms? Because if you don't know, it may not be easy for you to just walk yourself into hospital. You know, this is not an African culture where the government has supplied everyone with medical insurance, and therefore you can use your insurance anytime to check whatever disease, where you have a schedule on a yearly basis or monthly that this is my medical checkup month. We don't have such kind of things in Africa. They could be coming in, yes, right now, and a few people or a few people in some kind of class are able to afford this thing of I am going for medical checkup. Are you sick? No, it's not a Kenyan culture. How do we cultivate this?
So now it's to have maybe cancer champions. So how we can, with cancer, there are two things. There is the financial aspect, or maybe the resources aspect, that maybe there are not very many hospitals which are screening for cancer. Maybe there are not enough machines. Maybe there are not enough doctors or healthcare workers to screen for cancer. So these are resources aspects. But the more important one is there's a stigma aspect. Because you say, when I get this cancer diagnosis, and then what? So after that is I die. I'll just die. So people shy away from going to hospital. Whereas if we all went to the hospital and we made it clear to the management of even the very local dispensary that you want to be screened for cancer, imagine those resources will be made free by the government. So how do we end stigma? This show is a very good platform because we are doing a kind of advocacy so that even the woman who is watching this, who their job is just a grocer, or even is just maybe a gentleman who is watching this, and maybe they think in brackets they might not be able to afford. Let them go to the hospital and demand the services, because the government is the one that should provide for us as its citizens these services actually for free, because they are the same ones who are going to be faced with a very heavy burden of putting some people to undergo chemotherapy, buying radiotherapy machines, and they know that prevention is better than cure. It's even cheaper.
So such a thing has not yet reached and landed in our country, because it's, if you can, then you can get it. If you don't have money, then you just die and no one cares. If you don't find the resources here, then if you can fly abroad and get medication, then the better for you. That is how we are living right now in our country. No one cares. And so I don't even think that it's logical to just walk into a dispensary and demand for the services. If they do not have the machinery, they do not have. If they have no equipment, they do not have. You can actually do like nothing about it. You just die your own death and suffer in your poverty. I wonder really when the government is going to write to this. But Doc, talking about treatment, there's a lot of things that people have had to bring up to help themselves. There are those who are trying herbal medicine. They have to go to different places to get herbal. The people who know it's chemo and they cannot afford radiology, they cannot afford surgery, is way much too expensive. Do we even have local hospitals where these things can be addressed, or it's just for a particular field?
Let me give an illustration of what I meant. When I say like you go demand services, okay? During this month, maybe 10 years ago, nobody knew about that the October would be a cancer awareness month. Okay.
Yes.
Now, because of advocacy groups, you find October was made the breast cancer awareness month. Then cervical cancer awareness was also added. Yes. And now even prostate cancer has been added, and all the other cancers have been added, isn't it?
Yes.
So now how we can, so you can see already there is something which has already started. Now I can point another thing of people demanding services. For example, last year at Mata Hospital, which is where I work, they had an offer. If you go to do a pap smear January to September, it is 2,200.
Okay.
Or 2,500. It is expensive. Now, last year, during the month of October, the offer was 1,800. This year, because of advocacy, people going and saying, how can you charge us? This is supposed to be free. How are we going to pay? You find now this year, it's even subsidized even more. It's 1,500. Wow. Now, let's look at mammogram. Mammogram maybe 10 years ago was maybe 10,000 shillings. Now, with the month of October, it's been coming down. Last year, it was about 4,000 shillings to do the mammogram for a patient. Yeah. This year, believe it or not, it's 2,800 to perform a mammogram. Now, say a lady, we are going to say, maybe let's assume that's 5,000 shillings. So if we divide it over the whole year, you find less than 20 shillings per day. So anybody who is earning more than maybe 100 shillings per day can afford to give 20 shillings aside at the end of the year or at the end of 5 years or during the stipulated time to go for screening. So it should not be a hindrance. Anybody who is earning 100 shillings or more should not say, wamewezwa. No, that is actually an excuse. Secondly, we can actually go and demand the services. We have our local politicians. Those machines were bought recently with the Jubilee government. One of their pillars is health. So they bought some machines for diagnosing cancer, even in the district hospital. So let people go and demand the services. The machines are there. Maybe they're just locked up somewhere. Let them just demand. They'll be found. Even the doctors will be employed. Let them not fear.
Okay. So ladies, I hope you heard, together with men, let's rise up and go for screening to any hospitals around us, both local and even private hospitals. So Doc, I asked you about medication and treatment. There are those who are opting, because I've just been told it's stage 1, I don't need to have this lump or whatever surgery done on me. Can I just take herbal medicine? You know, there are those Indians who are very good in this.
So it depends. Actually, most or very many chemotherapy drugs have been derived from herbal sources. For example, there are trees even which grow locally in Kenya, which are used to make anti-cancer treatment. Locally available trees, they're exported and they go and make cancer drugs, and then they come back to be sold to us. Now, the second aspect is the preventive aspect, not the curative aspect, but the preventive aspect. There are some plants which are shown to boost the immune system to fight against cancer. For example, there is one which is called Moringa Oleifera, and there are many others outside there, but maybe let me highlight Moringa Oleifera. It's something which is available just in your local supermarket. It's something that grows it can grow in even a garden, even in Chalbi Desert, it can grow. So it's a very hardy crop, and you just take the leaves, crush them, and put them in your food or in your tea, and it's tasteless, and the immune system will be strong, and it will fight this cancer. Another one is things like garlic, ginger, carrot. All of them boost the immune system, and someone is able to prevent and also help cure the cancer. Though, when the cancer has been diagnosed, you have to be offered definitive treatment. So that is now the chemotherapies and the radiotherapies, that's when they come. So it's a must. Let's not think more herbal. Let's think going to the hospital, getting the cancer diagnosis, and getting the correct treatment. Don't rely so much on the herbal side, unless it's to prevent the cancer from growing in the first place.
Yes, you had mentioned this initially on our immunity system and boosting our immunity. Can someone actually stand and say, I will not catch cancer or cancer will not infect me because of how I am trying to live my life? What is this person trying to do? How are they trying to keep themselves?
So it's not possible to say that I will not get cancer, because as human beings, we cannot predict the future. But I can say I am reducing my risk of catching cancer in the future. So we state the modifiable risk factors. So stopping alcohol, stopping smoking, or there is also second-hand smoke. So I'm using a matatu, and the driver of the matatu is puffing away at a cigarette. I'm also participating in smoking that cigarette with him. So I'm a second-hand smoker. The third one is watching our diet. We want a more natural diet, less of processed foods such as junk food, less of chemicals in our food which we can't understand. For example, there are some spices which we don't know how they've been made. We don't recommend so many artificial spices. We want the natural spices. We want to cook our food the correct way so that it's not burnt. We also want to preserve our food very well, because there are some pesticides and chemicals which we use on the farm which are associated with cancer. At the same time, if we store our crops poorly, there is something called aflatoxin which can cause liver cancer. So we store our fruits and vegetables and even our grains properly. Then we avoid infections such as we've said HPV. There is also hepatitis, like hepatitis B and C, and also try to avoid maybe HIV.
Wow.
So now, if for one reason or another we cannot avoid, then we need treatment, and treatment for these diseases can help prevent cancer.
Okay, there are those myths. There are those myths that come with cancer or that people associate with cancer, like I can no longer use microwave for my food. I cannot use the paper bags for my food. What do you think about those myths? And people even say, once you have cancer, I mean, my friend, you're dead. This is a death sentence. Whatever you try, you're just dead.
What I can advise is it's actually kind of a form of ignorance that person is exhibiting. So when you hear of such a myth, you just know that this person needs to be given the correct information. So the correct information is that, one, many people recover from cancer. It's a disease just like any other. In fact, more people will die from malaria and TB this year than cancer. So it's just a disease like any other. And if diagnosed early, you will recover. For the risk factors, let somebody, if I think like maybe using the microwave or using this or using that is putting me at risk, let me go to a hospital and get the advice of somebody competent who can tell me yes or no. About the microwave, the microwave has been used for very many years, and nobody has cancer because of the microwave radiation hitting the food. About use of the plastic, if plastic gets burned, like for example, if you cook nyama choma and then you put it in a plastic bag, the way it is sold on the street, and that plastic paper bag is on the fire, it's going to the nyama choma will get the plastic will melt on the nyama choma. Consuming these plastics can cause cancer, can contribute, rather is a risk factor. Yes, let me say it is a risk factor for cancer, not a cause. Yes.
Okay. In our country, are there regions that are more cancer prone than others? As in,
Yes.
does the environment affect, like those who live near the lake, those who live near the mountain, those who live near the desert? Does that contribute in any way?
Yes. So depending on where somebody comes from, there are geographical but also cultural factors which come into play. For example, maybe moving away from cancer of the breast and cancer of the cervix, for esophageal cancer, it's been found to be very common around Bomet County. To be, I think, one of the highest incidents in the world is of esophageal cancer is around Bomet County. So
the number one in the world.
Yes. So what happens? Well, the research which has been done, or what they are thinking it is when culturally we are drying the maize, we put it above the fireplace, so that when the fire is burning, cooking the food, the heat from the fire is also making the maize to dry. But if you look at it in another way, there is smoke which is rising from the fire, which is going and coating the maize. It's going and coating the maize even as it's drying. So this coated maize with the ash, when we take it to make ugali, now we are consuming the ash. So it increases the risk of cancer of the esophagus. If we look at the lake region, now geographically, there is a lot of mosquitoes. Now, the lake region has been associated with more of a disease called Epstein-Barr virus, which can be spread through mosquito. And this virus causes something called Burkitt's lymphoma. Burkitt's lymphoma is a disease of the kidney which affects very young children. So Epstein-Barr virus, Burkitt's lymphoma, which is a type of a cancer. So those living around the lake will be at risk of one type of cancer. Those living in maybe a highland region, maybe in the North Rift region, will be at risk of a different type of cancer, and like this and like that. So what's most important is people to go to hospitals and to discuss what is my risk. Remember, health is individualized. What is my risk of getting cancer of the cervix? What is my risk? This is my lifestyle. What is my yes?
So cancer is not a death sentence. It is actually curable.
Yes, it is actually curable if detected
early. Okay, so once you discover that you are suffering from breast and cervical cancer, apart from, of course, you have already gone through the diagnosis and you have been told this is your stage and this is your level and this is what you need to do. What are some of the things that you need to do other than receiving the medication? You know, sometimes you're not told stop taking sugar, stop taking tea, stop taking coffee. What are some of those obvious things that a doctor will not tell you that you just need to lay off as part of your lifestyle?
If the doctor is not telling you, then you should come to see me because at least I'll tell you. That being said, for generally when somebody is being on treatment for cancer, they are very unwell. Say it's for cancer, they are not very strong. And another thing, the chemotherapy and the radiotherapy also have a heavy toll on the body. So we need somebody to eat a balanced diet, eat more of the traditional foods and vegetables, more than the maybe the very maybe the spaghetti.
The meat.
So we want to do more of the natural foods. We want to take immune boosting foods. And the good thing with those things is they will suppress the side effects of the cancer. For example, vomiting, heartburn, yes. But eating more of the processed foods like biscuits and a lot of snacks, then they increase the side effects of the medicine.
Okay. How about exercise? You know, when your body is beaten, you're low, and you have nothing, you know, no strength in your body, are you still supposed to make your body active? How do you activate your blood vessels, even in this condition? Or once you're going through chemo, your life is like stagnated, and now you just rest and rest and rest?
We advise somebody who is on chemo to go for palliative care. And this palliative care, a big part is they cater for the psychological and the physical needs of the body. For example, somebody might be too weak to get out of bed, or maybe another one might be very stressed, like maybe what am I going to do, like where will I get the resources to continue with the treatment. So through palliative care, they are able to do for somebody physical therapy, for example physiotherapy for those who can't walk. For the ones who have energy, they are told to do things like yoga, things like Zumba. In addition to that, for psychological care, we offer stress coping strategies such as counseling. So this one is very important for somebody who is a cancer warrior to also have, in addition to the treatment which they are receiving.
Wow. Thank you, Doc. That has been a lot of, you know, TMI, and I hope that we have received this with uh, with joy, because sometimes you get information and you're so much set back and you're wondering what to do, and you're just like, I wish I never had. But we have received this with joy. We are gonna action on it. Please tell us your last words and maybe how long a cancer treatment may take, and then we will end up our show.
So maybe what I can tell to all our viewers is that this cancer thing is real. It's just a disease like any other, and people recover from it so long as they have been diagnosed early and offered the correct treatment. So they should come to see me or their preferred healthcare provider wherever they are in Kenya or even throughout the world, and so that they can receive the correct care that they need. Myself, I'm located at the Mater Hospital, so they can come and then just ask for me or even any of my colleagues, where they'll be able to get the correct help. And finally, to remember that the screening is subsidized this month. So let them not say, I'll wait for next month. The offer ends at the end of this month. Kindly go and be screened. There are still, I think, 19 more days to go for screening. So this show, thank you so much for you, Betty, because you're doing the right thing by telling people to move, mobilize, and keep it up.
Okay. Thank you. Thank you so much for your time and the information. We are gladly receiving it. Thank you also, viewer, for watching this episode of Chungu Jamii. I have been your host. My name is Betty. Please take the right action and go for screening as doctor has advised. See you next time.
Thank